Hello, welcome to another episode of Arthritis and You, A Joint Journey. Today, we've got something special lined up, so buckle up because it's time for the deep dive. Let's give a warm welcome to our hosts, Arthur and Sarah.
All right, so picture this. You're just going about your day, everything's normal, and then bam, this headache hits you, like really hits you. Harder than any headache you've had before.
Yeah, that's not something to ignore.
Definitely not. It could actually be a sign of something serious. Something like giant cell arteritis.
GCA, that's right.
GCA. And we've got some really interesting research from a leading rheumatology group. So let's dive in. What is GCA?
Well, it's a vascular disease. It involves inflammation, but it's not like arthritis where it's in your joints. With GCA, the inflammation is happening in the arteries, often the larger ones.
Okay, so blood vessels, inflammation, and we're not just talking about any headache here, are we? It seems like this mainly affects a certain age group.
You're right. We are talking about people over 50, primarily. And when I say over 50, I mean it peaks between 70 and 80 years old, with women being more likely to experience it than men.
So definitely something to be aware of as we, get older. Why is early diagnosis so crucial here?
Because those arteries that are inflamed, they're not delivering blood as effectively, and that can cause damage, serious damage, even vision loss if it's not treated.
Wow. Okay, so we're not messing around here. This is serious stuff.
Mm-hmm.
All right, let's get into the symptoms. What should people be looking out for?
Well, you already hit on one, the headache, but it's not your run-of-the-mill headache. This is different. It's usually a new kind of headache, more intense, maybe in a different spot than you're used to.
A new pattern of headache. Got it.
Exactly. And then there's scalp tenderness, especially around the temples. People describe it as feeling like they got hit in the head, even if they didn't.
Ouch. Yeah, I can imagine. That would be pretty noticeable.
You would notice.
The research also mentions jaw pain.
Oh, yeah, that's a big one. And it's specific. Pain when you chew, trying to eat becomes a problem.
Wow, that sounds awful.
It can be.
Now, there are also some more, general symptoms listed. Things like fever, fatigue, even weight loss.
Yeah.
How do those fit in with a blood vessel problem?
Well, it all goes back to the inflammation, right? When your body's fighting inflammation on a larger scale like this, it can trigger those systemic responses. Your immune system is working overtime.
So these general symptoms, while they could be a lot of things, shouldn't be ignored, especially alongside that new severe headache pattern.
Exactly. And speaking of things not to ignore.
Yes. There was one symptom in these sources that both kind of screamed, get to the ER now.
Vision changes, right?
Vision changes, yeah. Sudden vision loss, anything like that. Why is that such a big deal with GCA?
Because, remember, it's about blood flow. And your eyes, they need a constant supply of oxygen-rich blood. Any disruption to that, even temporary, can damage the optic nerve.
And that can lead to permanent vision loss.
I can.
So any vision changes, even if they seem minor, you've got to get them checked out immediately. Don't wait to see if it gets better on its own.
Absolutely not. Early diagnosis is key. I can't stress that enough.
Okay, so we've got the what of GCA, the warning signs. Let's say someone is experiencing some of these symptoms, goes to the doctor. What happens next? How is GCA diagnosed?
Well, it usually starts with a conversation. Your doctor will want to hear all about your symptoms, when they started, how often they happen, how severe they are, everything.
So that initial conversation, really important.
It's crucial. Then, based on your symptoms and your medical history, they'll do a physical exam.
Looking for
Signs of inflammation. They'll probably focus on your temples because the temporal artery, which runs along the sides of your head, is often affected.
So they're feeling for any tenderness, swelling, maybe even a strong pulse in that area.
You got it. They might also check your pulse in other areas, your wrists, your feet, just to compare. And then, oftentimes, blood tests are ordered.
The good old blood test. So can they diagnose GCA with a simple blood test?
I wish it were that easy. There's no single blood test that definitively says you have GCA. However, there are markers of inflammation that doctors look for. Things like C-reactive protein or CRP and erythrocyte sedimentation rate, ESR.
Okay, so those are like red flags in the blood work that something's going on, but not necessarily a GCA diagnosis on their own.
Exactly. Think of CRP and ESR as your body's inflammation alarm bells. Everybody has them at low levels, but when your immune system is fighting something, the levels of these markers rise. They tell your doctor that inflammation is present, but they don't tell them where in your body it's happening.
So the blood tests give clues, but not the whole picture. What comes next in the diagnostic journey? I know the research mentioned biopsies, which sound a bit more sorrying involved.
You're right, biopsies are the next step. They might sound intimidating, but they're actually very common and can be the most accurate way to diagnose GCA.
Let's talk about that. What does a temporal artery biopsy involve?
So, a temporal artery biopsy, it's basically taking a small sample of the artery, the temporal artery, to look at under a microscope.
To look for those giant cells. That's what gives the condition its name.
Exactly. Those giant cells, they're a dead giveaway under a microscope. Really confirms the diagnosis.
Okay, that makes sense. Now, the research also mentions some newer imaging techniques being used for GCA. Things like ultrasounds and PET scans.
Yeah, technology is really changing things. Take the ultrasound, for example. Temporal artery ultrasound is painless, completely non-invasive, uses sound waves to create images of the arteries in your temples so doctors can actually see if there's inflammation, narrowing, anything like that.
So no need for a biopsy in those cases then.
Well, it depends. Sometimes an ultrasound is enough, especially when you consider all the other information, the patient's symptoms, medical history, that kind of thing.
Makes sense. What about PET scans? Those always seem kind of, I don't know, futuristic to me.
They're pretty incredible. So with a PET scan, you're injected with a special solution, a radioactive sugar solution. It's totally safe, by the way, but the cool thing is areas of inflammation in your body, they absorb the sugar more quickly. And the scanner can pick up on that. So it basically creates these detailed images highlighting any areas where there's active inflammation happening.
Ah, so if there's inflammation in the arteries, the PET scan would, light it up.
Pretty much. It gives doctors a really clear picture of what's going on, how widespread the inflammation is, which can be super helpful for diagnosis, even for planning the treatment strategy.
Wow, that's amazing. So with these advancements in imaging, are biopsies becoming less common for GCA?
They're still considered the gold standard, the most definitive way to diagnose GCA. But these newer techniques, they give doctors more options, which is a good thing, especially for patients who maybe can't have a biopsy for whatever reason.
Right. So more tools in the toolbox, that's always a good thing. But let's be real, getting a diagnosis of GCA, it can be scary. So let's talk about what happens next. What can people expect if they are diagnosed? So someone gets this diagnosis, GCA, what happens next? What's the treatment like?
And the good news is GCA is very treatable. Most people respond really well, especially if we catch it early.
Okay, that's reassuring. So how do you treat it?
The main treatment for GCA is corticosteroids, specifically a medication called prednisone.
Prednisone, yeah. That's a pretty strong anti-inflammatory, right?
It is. It works by calming down that immune response, the inflammation in the blood vessels. And the great thing is it works fast. A lot of people, they see their symptoms improve within days of starting prednisone.
Wow, so it really gets that inflammation under control.
It does. But here's the thing about prednisone. It's not a long-term solution. More like a reset button than a lifestyle change.
Because of the side effects.
Exactly. Long-term prednisone use can cause other problems: weight gain, bone thinning, mood, changes things you don't want to deal with long-term.
Yeah, no kidding. So how do doctors manage that? Is it a matter of finding the lowest effective dose?
That's part of it. The strategy is usually to get the inflammation under control quickly with a higher dose of prednisone at first, then very gradually taper down the dose over time, all with close monitoring by your doctor, of course.
So it's about finding that balance, controlling the inflammation without causing other problems.
Exactly. And that balance, it's different for everyone. That's why those follow-up appointments are so important. Your doctor will adjust the medication as needed, make sure you're on the right track.
A real partnership between doctor and patient.
It has to be. Now, the information you shared also mentioned some newer medications, these steroid-sparing drugs.
Yes, steroid sparing. I mean, the name says it all, right?
Right. The goal is to reduce or even eliminate the need for long-term prednisone use.
Makes sense. So how do these steroid-sparing drugs work?
They target different parts of the immune system, which helps to reduce the inflammation without relying solely on steroids.
So are these newer medications becoming the go-to treatment for GCA then?
They're being used more and more. For some people, they might be the right choice right away at diagnosis. For others, it might be something that's considered later, if they're having trouble tapering off prednisone or experiencing side effects.
So there are options, and it really depends on the individual.
Exactly. And it's important to remember treatment for GCA isn't just about medication. There are things you can do yourself to help manage the condition.
Like lifestyle changes.
Exactly. We talked about bone thinning with prednisones, staying active, getting enough calcium and vitamin D. That can all help.
Right. Good old healthy lifestyle.
Can't go wrong with that. And as with any health condition, good communication with your doctor is key. Ask questions, address any concerns you have, be your own advocate.
Absolutely. Knowledge is power. And we've learned so much about GCA today, but as we've seen, there's always more to discover. We started talking about this mysterious headache, a sign of something more serious. And now, well, it seems like GCA might actually hold some clues to understanding other inflammatory and autoimmune diseases too.
That's what makes this whole field so fascinating. The more we understand about the immune system, the better equipped we are to address all sorts of health challenges.
It really makes you think. What might seem like one isolated condition can actually unlock a much bigger understanding of the human body and how it works. And who knows what new discoveries are just around the corner. Well, that's about all the time we have for today's deep dive. If you or someone you know is experiencing any of the symptoms we've talked about, don't hesitate to reach out to a doctor. Early diagnosis and treatment make all the difference. Thanks for joining us.
This has been another episode of Arthritis and You, A Joint Journey, brought to you by the Rheum team from albertarheumatology.com. Your trusted, evidence-based suite of resources available 24/7. Straight from Alberta, but for folks around the world. Our hosts today, Arthritis and Sarah Upis, technical producer, John Ifun, and our executive producer, Stephen Cates. While we work hard to maintain the accuracy of our information, we accept no legal responsibility for any errors or omissions. Remember, always check with your own physician first. Join us next time for another Deep Dive.